Right, next slide we're going to look at joints. Several different types of joints. We have fibrous joints, cartilaginous joints, synovial joints. Three different kinds of joints. Fibrous joints, firstly, they're also known as immovable or fixed joints. These joints cannot move as they have fibrous tissue between the bones. So examples of that is the plates in the skull. You may well think that the skull is just one big bone. It isn't. There's a number of joints in the skull, and obviously they can't move, they're just fixed. The next kind of joint we're going to look at is cartilaginous. So they're known as slightly movable joints. So there's often a pad of fibrocartilage between bones that form the joint. This allows for a slight movement where the pad of the cartilage is compressed. So examples of that are joints between the ribs and the sternum, where there's a little bit of movement. Finally, the main classification of joints is synovial. These are known as freely movable joints, and they're found all over the body really. They allow a wide range of movements, and there are 6 types of synovial joints. We have a ball and socket, a gliding joint, a pivot, ellipsoid, saddle joint, and a hinge joint. We go a little look at them now. A synovial joint, a typical synovial joint is found in the hip, and this is a ball and socket joint. The next synovial joint we look at is a hinge, and the knee is a good example of a hinge joint. So it can only move in flexion and abduction and extension. A pivot is where something rotates around a point. So the atlas or the axis joint at the base of the skull or the top of the spine is a good example. We look at the saddle joint now, which is a carpo to metacarpal joint, which is basically from the hand to the base of the fingers. A gliding joint, so a good one of those is in the acromioclavicular joint, which is where the clavicle attaches to the shoulder. And an ellipsoid, which is interphalangeal, so that just means really in between the fingers. We're going to look at a structure of a synovial joint. This is a good example of one. Again, this is something you need to really look at and learn. So you can see that each of these joints have a membrane around them, which is filled with synovial fluid. Synovial fluid is secreted into the joint when the joint actually moves, which is why often if you're a bit stiff in the morning, if you start moving around, as soon as that synovial fluid is secreted into the synovial joint, then you're going to be able to move a little bit easier. Connective tissues are important around joints. So we have the cartilage that we just spoke about. Tendons, ligaments make up connective tissue. We have hyaline cartilage and elastic cartilage and fibrocartilage. First we're going to look at ligaments. And ligaments connect bone to bone, and they play a big part in structure. So they enhance joint stability and they guide motion as well. They prevent any excessive motion in the joint. So if you look at a knee, for instance, it's really the structure is held together by a lot of ligaments. If we look at a tendon now, these attach muscle to bone, and they transmit forces that are produced by the muscles. So tendons not to be confused with ligaments. We're going to look at kinesiology. So kinesiology is movement really. So flexion is the first one, and flexion is to reduce the angle at the joint or to bend the limb. So if you were to bring your hand up towards your shoulder, the elbow joint will be flexing because the angle of the joint is reducing. And the extension will be the return journey of that. So from flexion, straightening the limb, or to actually increase the angle of a joint. And then we have rotation, which is a rotary movement, inward and outward, about a long axis. So, in other words, thoracic vertebrae, something like that. Abduction, which is to take it away from the midline of the body. In other words, raising the leg or the arm to the side. If you think of someone being abducted, they're taken away, so it's a good way of remembering it. And then adduction, which is adding towards the midline of the body. So It's the return from abduction, really. So quite simple if you look at it like that. Horizontal flexion, a forward movement in a horizontal plane. So if you imagine doing a fly or using pec deck, this is a movement in the horizontal plane. Horizontal extension is a backward movement. So if flexion is bringing the arms in, extension is taking them away. Lateral flexion is a spinal movement, so it's a bend sideways with the trunk or the neck, as in side bends if you do those. Circumduction is to circle a part of the body, so hip and shoulder circumduction is quite often seen in warm-ups for the footballers take part in. Elevation is the upward movement of the shoulder girdle, so if you shrug, that's an elevation movement, and depression is the return of a shrug, so downward movement of the shoulder girdle. If we protract something, then we move a forward movement of the shoulder girdle, so bringing the shoulders towards the front of the body, and to retract them is to take them back, so backward movement of the shoulder girdle towards the back of the body. If we pronate something, we place the palm of the hand facing down towards the ground, and the opposite of that is supination, or the palm of the hand facing upwards. A good way of remembering that is imagine holding a cup of soup in your hand. Dorsiflexion is a movement in the foot, so to pull the toes up towards the body, in other words, in something like a heel dig. And then plantar flexion is to point the toes downwards to the floor, away from the body, for example, standing on your tiptoes, or imagine planting something in the ground, pointing your foot downwards, plantar flexion. Inversion is the drop of the sole so it faces the midline. So people that you may have heard of flat-footedness, this is with people that have inversion issues. And the opposite of that is eversion, where the sole of the foot actually faces away from the midline.